Hi everyone, good evening and welcome to Helpsy's Health Series. Today we are going to be talking about healthy aging. I think we can all use some tips and tricks there. And we have a great speaker with us, Dr. Sherry Fong, who's going to be talking to us about healthy aging. Hi Sherry.
Hi everyone.
Welcome. So Sherry has 26 years of practice as a chiropractic physician specializing in men and women's health, pain management and rehab, natural aesthetics, weight loss and nutrition in her two clinics in San Francisco and Daly City. She graduated from Life West Chiropractic College and did postgraduate studies in the Chiropractic Neurology Diplomate program. Her focus includes Shockwave, Lite Cure laser, injury and trauma care, management of chronic and complex pain, post-injury, myofascial release, medical massage therapy, physiotherapy, health and nutrition coaching, and education. So she handles quite a lot. So the way she got interested in nutrition and natural healing modalities in 1994, when her grandmother who raised her was diagnosed at 94 years old with cancer. She researched earnestly to find a cure for her with natural medicine. Resources were limited then without internet. She researched and read many books on nutrition and natural cures, and she's able to help her grandmother recover from cancer, who lived for almost 100 years old. Since then, she has dedicated her practice to assisting people in the prevention of disease, weight loss, and achieving their own personal level of optimal health. She started innovative body concepts to provide men and women a safe, comfortable, caring place to transform their health with support, education, and fitness so they can experience their own elevated level of energy, vibrancy, and health. So welcome, Sherry.
Thank you, Santika.
Wonderful. Well, what a great introduction. You have both professional experience and the personal motivation with your grandmother.
Yes, my grandmother was the mother who raised me, so I call her my granny mom. She was 94 when they diagnosed her with lymphoma. The doctors were very skeptical if her body was able to tolerate radiation, yet the tumor was growing and obstructing her breathing. It was very disheartening to watch her suffering. And at that time, resources were very limited, and I was determined to help her recover. And I did the research, like you said, and we prepared her body for radiation. I approached the doctor and said, if you give me 6 weeks to prepare her body for radiation, could you give it your best shot? And he said, yes, if she is still as healthy as she is today, and if she's willing. So she went in, they prescribed 12 radiation therapy sessions, and she had 7, and the tumor was reduced, and we brought her home, and she was breathing fine, and she was tired, and she was lethargic, and she was depressed, and she had no appetite, she had sores in her mouth. So we helped her reduce the tumor, but her quality of life was also very much reduced. And I brought in energy healer that came to the home and worked on her every day for 2 weeks, and she completely recovered all her energy. And at 94, she was walking without a cane. She was cooking and cleaning in the house. She lived with me, and she was telling me what to do again and what not to do, like a 4-year-old.
That's
And
wonderful.
that's how we knew we had granny mom back. She was back to all her advice and sharing her wisdom with me.
Wow, what a great recovery. And it's amazing that even at that age, while she was going through radiation and after radiation with fatigue, you're able to help her to recover from her health. So you touched on some key terms, and I would like to hear your definition of it. What is your definition of two terms? One is quality of life, and second is integrative medicine. What do those terms mean to you?
Quality of life to me means being able to live independent. independently and being able to do all the things that we love to do that are meaningful to us. And that was what my grandmother had in her 90s. She was able to live alone, and she lived with me when she wanted to live with me. And she was able to care for herself. After the cancer, we did hire a companion to stay with her. And the quality of life that I, aim to have is to keep my brain very flexible and plastic, so that I'm always open-minded to the latest and the newest, and embracing what's most effective in helping people's health, and cost-effective. Cost-effective is also very important. And I think with the whole preventive health industry exploding, we have a lot of things to look forward to that's going to give us great quality of life as we age. I think we live in a great time that we can live into our 70s, our 80s, and our 90s and still remain very independent and doing all the things that we love to do.
Wonderful. I love those definitions. I think being able to do the things we love to do, that's what gives us that power and that drive to wake up and want to live the new day. And for us to be able to leverage integrative medicine to provide that power to people is so gratifying. It's wonderful. Can you share with me how you are enabling this integrative medicine and quality of life in your practice? So what are the different facets of your practice?
Well, first of all, I think about that's a very good question. I think a lot about what it means to me to have, a practice that's based on integrative medicine. And in my opinion, it means restoring and rehabilitating the whole body, embracing every aspect of the individual's spiritual, emotional, mental, and physical needs. It's utilizing also various forms of therapy, therapeutic modalities, restorative exercise, stress management tools, skills, consuming organic foods, whole foods, and a range of medicine that's available, from homeopathic nutritional supplements and herbs to allopathic medicine, on an as-needed basis, starting with the least invasive option and implementing a lifestyle that best supports a healthy recovery.
Oh, wonderful. Can you, let's go a little bit deeper into some of these things. You talked about nutrition, you talked about stress management. Can you share with us some examples of how you help people in these areas?
Well, I take a look at where people are when they come in. Everybody is at a different time where they're ready to make certain changes, and some are not ready to change their entire lifestyle. What's very important, I feel, is the basics is we have to get enough sleep. We have to be well hydrated. We have to have 3 nutritious meals a day. And this is what I sit down and discuss with my patients and see how we can work the basics into their lives. And then the other is movement. We need to be able to restore our bodies with exercise. And again, that means very different meaning for different people. Some people are in too much pain to be at the gym, and they're able to do restorative exercise. And some people are at a place in their life where they're ready to train and get fit, and we discuss that. Different people needs are very different. That's why with integrative medicine, I think it's very important for me to sit down with a patient and find out what are their spiritual needs, what are their emotional needs, what are their mental needs, and what are their physical needs. They need to reduce the stress in their lives. Stress destroys our physical body. It starts with the stress that we have at work, stress that we have with our families, when we feel this a lack of harmony, when we feel lack of peace, when we don't have good connections in our relationships, we create a lot of stress in our physical body. So a lot of those things can't not be changed, but what I'm doing there to help with my patients is so that they can handle it better. How can we create a situation and a lifestyle where you can handle the stress that you cannot change? I think it starts with that.
Wonderful. That's beautiful. I think that's a great way to put it. I think because we don't always have control of full control of the situation, or we cannot control other people. But if we can see how we can utilize the tools and how we can set ourselves up to handle the stress. It sets us up for success. So that's really wonderful. That's great to hear. Can you share with me, you talked about how different people are quite different, their needs are different, what their capacity of doing is different. So in your practice, what are the typical type of patients you are looking at?
The first category of patients that come in to see me have chronic pain. They generally have had pain for many years, and they've gone to standard physical therapy, pain management, medication, exercise. They've gone to chiropractors, they've gone to acupuncturists, and that's about 30% of the people that don't respond to standard care, and they need extra help. And I do natural detoxification for them. We use device to help to break up scar tissue. We use lasers to help regenerate the area. And most important is I put them back into a lifestyle where they are helping themselves. They are doing movement and exercise. They're eating right. They're learning what foods work for them, what foods don't work for them, because it's just as important to help the body. It's important to stop what doesn't help the body. And so that's one category of patients. Another category of patients are patients who have acute injuries. They fall at home, they got hit by a car, or they reach down and they can't stand back up, or they put on a jacket and they can't move their shoulder. And that's fairly easy to treat. And also I work with their lifestyle to find out how they had an injury by just bending down to pick up something, and why their back muscles are as tight as they are, because again, it comes back to stress. And for those who get injury in a fall or been in a car accident, we discuss what's the fastest way they can help themselves reduce the inflammation to speed up their recovery. Then we have a third category of patients that have metabolic syndrome and age-related weight gain. And it's important that we teach them how to do natural detoxification, and then to do natural hormone balancing, and get their body back in a position where the body stops storing fat, and put them back in a position where their body is burning fat naturally the way the body knows how to, as long as we create balance in the body.
Great, wonderful. So let's talk about each of these categories, because I think you touched on some interesting points. You talked about the aging, as we age, and the metabolic syndrome. So since this is a healthy aging session, let's go a little bit deeper into that and share about what are the challenges you see as people are aging, and what can they do for themselves to address it.
Well, let's start again with why the body ages ages in a way that doesn't serve us. And that again goes back to is why is the person stressed? Generally, there's unhappiness with their job, there's unhappiness and disconnections with their relationships, and there's sort of a sense of when people reach middle age, sometimes there's a sense of they rethink their lives, and they feel they've lost their purpose in life. And that leads a lot of times to emotional eating, too much alcohol consumption, and too much distractions in life that doesn't serve the individual. And when we put too much toxins in our bodies, such as when you overconsume alcohol, medication, eating foods that are not healthy, it causes the body to store a lot of excess metabolic waste, and that is what toxins are. And they tend to store in a safe place in the body, which is called the subcutaneous fat layer. The subcutaneous fat layer is right above the muscle and underneath the skin, and that's the safest place the body knows how to store fat, where to store toxins in that layer of fat. And stress will cause certain hormones to expand those fat cells and create blood vessels to spread the expansion of those fat cells in order to protect the body and to keep the body going. going. And that's why we're able to walk around with 30, 40, 50 pounds of excess weight, and yet we get up every morning, we function, and we go to work. And people think, well, as long as I'm getting up and going to work, I'm healthy. But they're not healthy. They're walking time bombs for heart attack, for stroke, for arthritis. Therefore, they can get cancer, hormone-related cancer. It puts them at high risk for all the above. And if they have arthritis and pain, they don't exercise. They don't want to move, and they eat more comfort food. So when I help these people, we get down to discussing their lifestyle, where they are willing and ready to change in their lifestyle. I put them on a homeopathic detox. I get them into an infrared sauna for detox, and then we put them on a very strict but very healthy diet based on whole food eating. So no more sugar, no more processed food, no fried foods. And people will lose between 20 to 100 pounds, and they reverse their hypertension, their high blood sugar, their all their blood markers that indicate they have metabolic syndrome. That all reverse with 20 to 30 pounds of weight loss.
Wonderful. So by doing healthy weight loss, being on a good diet, a good exercise plan, like you said, and stress management, they're able to work on reducing their weight, and specifically working on the strategies you create for them, and that helps to address many of the diseases that people tend to get. We tend to get as we are aging, if I understand correctly.
Yes, so with metabolic syndrome, it's very important to understand it's not a disease, it's a condition. And the condition is a result of a lifestyle that the person is struggling, usually taking on too much stress. And when they take on too much stress, they start eating poorly and not finding time to move, and not finding time to get sufficient rest, and not finding enough time to hydrate themselves. And then the body adjusts to that change, and it's trying its best to survive, and it does that by expanding the fat cells and packing on the weight.
Right. So if they can manage their stress or address their stress better, then they're not constantly carrying that and having that in their body, and that helps.
Well, it starts with stress management, but a lot of times by the time a person has 30 pounds or more to lose, they need help, because the fat storing hormone is too high of a ratio compared to the fat burning hormones in their body. And so they're at a position where if they exercise, they get more hungry and they eat more and pack on more weight. If they don't exercise, they still pack on more weight because they have more fatty tissue and they're more fatigued. So they reach a place where they're stuck. If they exercise, they gain weight. If they don't exercise, they still gain weight, and no matter what they eat. So they can eat very healthy, and they can try to exercise, even though they have pain lots of times, and they still are putting on weight, or they can't take off weight. And then it's frustrating, and people throw up their hand and say, well, I'm just going to eat whatever I want. It doesn't make a difference.
Right. So I think having a specific plan, working with you, then that helps to break this cycle, because it's kind of a vicious cycle that they get into.
Yes, and then
the body gets into that cycle.
Correct. Now, I got into treating metabolic syndrome mostly because I started with treating pain management. And I had people come in to see me with chronic pain, 10, 20, 30 years of pain. And a lot of it had to do with the metabolic syndrome causing the weight gain, and they wear out their knees, they wear out their spine, their hip joints, and they are not exercising due to pain. So with the chronic pain management, we use device to help rehabilitate areas that have been degenerated due to many years of inflammation, and the joint actually breaks down, causes stiff joints and stiff, weak muscles, and they feel very vulnerable and unstable. They feel like if they just do a little bit too much, something will go out. And so their knees easily hurt when they take the stairs. Their back hurts when they walk up the hill. And so it started with me treating people with chronic pain, that I realized if I don't help them with their weight, I can't help them permanently with their pain, and then they're dependent on constantly coming in. And where I like to take my patients to is to the quality of life I talked about earlier, is where they're independent and spending their time doing everything they enjoy doing and not at a doctor's office.
Absolutely. Absolutely. So you talked, we started to talk about pain. So let's go a little bit deeper into that pain management. Can you talk a little bit more about the causes of inflammation and how that's related to pain, and what can people do to address this chronic pain? Because, you were saying like how a lot of people are coming in with 10, 20, 30 years of pain, and we tend to see that in our population as well, where many of us have many years of pain, or we are working on treating people with several years and decades of pain. So what are the causes for it, and what can people do to manage their pain and alleviate it?
The cause of pain is due to inflammation, and inflammation is either due to trauma, injury, or constant wear and tear of overuse, and stress. Again, stress causes our body to release stress-related hormones, and these hormones actually cause the joints in our bones and to break down, and it causes it to age much faster than it needs to age, and then it sets us up so we're prone to wear and tear type of injury. So it starts again with going back to finding out what is stressing you out in your life, and if those things cannot be changed, how can we change to be more tolerant of the stress? And restorative exercise is one thing that we all can do to help ourselves. So we all understand going to the gym and running. We all understand what lifting weight is, and we understand what exertive type of exercise is. And I promote restorative exercise, because restorative exercise allows you to move even when you are in pain. So that includes Tai Chi, Qigong, restorative yoga. And I think that's important in everyone's life, without, minimizing all the pain and arthritis that's due to aging. So I have an interesting story to tell you, that recently a patient came in to see me. He's 60 years old with a terrible spine. And he says, my brother, sister, and I, the three of us are between 50 to 60, and we all have terrible knees and spines. We all have careers that require us to sit 10 to 20, 12 hours a day. And our mother is 85 years old. She started restorative yoga when she was 40. And when she turned 60, she became a restorative yoga instructor to give back. And at 85, my mother is healthier than all of us. She has no pain, and she has no health conditions. And she wakes up every morning and teaches restorative yoga. And I thought, what a wonderful gift to give to your children, where your children don't need to worry about you, and they don't need to be concerned about your health. You're 85, living independently, but what a beautiful gift to give to your children.
Oh, it's so beautiful. It actually reminds me of my great grandmother. She lived with us, and she passed away when she was close to 97, I believe. And she was so healthy as a horse. She really followed Ayurvedic diet and lifestyle, and she got up in the morning and she would drink her water, and she would do her yoga and her meditation, no matter what. And she lived such a healthy life. There's so much power to this, to these practices, and to the restorative practices that you talked about, I think, especially the yoga and the Tai Chi and Qigong. So do you give specific poses, or can people find specific poses? How can they start this practice? Can they just go to a class, like a group class that's in their area? or buy a
Well, depending,
DVD?
Well, depending on people's schedule, and that's why I talk to them, work with them. And there's apps on the phone. I mean, if you have a smartphone, there's apps that you can Google to get these restorative yoga lessons. If you belong to a club, they usually have these classes. There's some community classes, and then then there's private instructors that you can hire to come to your home. So it depends on an individual's ability to leave the house. If they have young children, it might be more difficult, and the apps would serve them well. And if people can leave the house, I would say start with the private lessons and then go into group classes.
Wonderful, wonderful. So you talked about the restorative practice for nutrition. Do you give any specific suggestions for the pain management and reducing inflammation?
Well, in my practice, what I do is I do lab work. I have patients come in, we do lab work to see where their deficiency is. So whatever I prescribe and recommend to them is very specific where we see they have deficiency in the lab work. And 2 months later, we do another blood test to see the improvement. And that helps us to monitor how people are improving and responding to the supplements. And they know exactly what they're taking and why they're taking it.
Okay, I see. That's wonderful. Yeah, so they're able to track their health and see how it's improving. That's definitely very motivating, I
Yes.
assume.
We also monitor their weight and measurements because it's not just
Mm-hmm.
weight, it's also measurement. And as we start to close the gap in on where they're deficient, we also see people naturally getting leaner. Even for people who are not extremely overweight, they naturally get leaner because their body's getting healthier and is no longer actively storing body fat.
Right, right. Oh, that's wonderful. Wonderful. So I think that kind of leads us into, these are common principles that we talk about when it comes to disease prevention. So, not just for pain, but even overall in terms of disease prevention and general health, what do you suggest that we can do on a regular basis?
I think it's very important to start with looking at your lifestyle and seeing what stresses you out, and be able to ask yourself, if can you change what's stressing you out, or can you not change what's stressing you out? And if you cannot change what's stressing you out, it's important to either figure out how you can change your attitude or find help. Find help how you can change your attitude to address the stress that you cannot change. And I also think that we need to connect with the meaningful relationships where we have disharmony. We need to make those connections peaceful and harmonious so that we can feel at peace with those meaningful relationships with our children, with our parents, with our partners or former partners. And then the third thing is you need to be very proactive in educating yourself. There's so much opportunity for education these days. Go on webinars like this one and take educational classes, do research online, read science-based research and science-based articles, support the authors that are working so hard to write books to educate us. And then looking at your diet and choosing food as if you would choose medicine for your body. Eat as if food is medicine. Eat consciously, eat mindfully, eat with asking yourself at each meal, what are my healthy fats? What are my healthy proteins? What are my healthy fibers? And did I get enough water today? And did I get my 2 fruits today? So plan out your daily eating schedule so that you're eating mindfully and choosing very specific foods that you need to help your body for different conditions. So if you know that you have, for example, a condition with high cholesterol, eat more fiber in your diet. Ask yourself each day, where are my fibers coming from? And plan on eating foods like cucumbers and celery and apples so you can get your natural fiber to lower your cholesterol naturally rather than having to always be dependent on a pill.
Right. Yeah, I think it's so true. food is medicine, and if we look at each item in our food and choose that in terms of making sure we have a well-balanced meal, we have a healthy meal, we can truly empower our bodies with all the nutrients that we need. And as a result, the more our body functions naturally and in a healthy manner, the less we need to depend on medications for some of these symptoms and chronic problems. So I think you shared that very well. Thank you, Sherry, for that. Can you, since we're talking a lot about what people can do on their own, what we can do on our own to take care of ourselves, let's touch a little bit on what kind of things should we be careful about and not do. So what are the things that you would not recommend people to do?
Well, one important thing I tell all my patients is do not eat a low-calorie diet. Contrary to what we think, eating a low-calorie diet helps us to lose weight. Low-calorie diets slow down our metabolism and cause our body to tend to store fat more easily. So don't worry about the calories. You know, when you sit down to eat, ask yourself, where am I getting my healthy fat? Where am I getting my 4 to 6 ounces of healthy protein? And where am I getting my 2 to 4 cups of healthy vegetables? You know, and then how many where am I getting my 2-3 servings of fruits during the day? That's much more important than to count calories and worry about how much fat is in your diet. Our body needs healthy fats, so that's very important for people to understand. If you don't eat enough fat, your brain doesn't work because our nervous system is mostly made of fat. So healthy fats to eat are like grass-fed butter, coconut oil, olive oil, avocado oil, sunflower oil. So cook with healthy oils. Unfortunately, most restaurants use canola, soy, or corn oil, and those are the most unhealthy oils that cause inflammation in our body. And it's the number one thing we need to avoid is unhealthy oils and refined sugar. And we can get healthy sugar from our fruits and vegetables, and especially our root vegetables. You can get plenty of sugar from those vegetables, and we don't need to eat the refined sugars and eat dessert like a condiment. You know, if you're going to have dessert, just share it with 4 other people. But truly avoid eating refined sugar and the refined oils as much as possible, and sticking with healthy fats, grass-fed protein, wild protein, and stay away from the grain-fed proteins because they are a totally different makeup from the grass-fed proteins and the wild proteins.
Wonderful. I think those are some really good tips that we can all think about not focusing so much on the low-calorie diet, but on really getting all the nutrients in our diet. And like you said, eat the root vegetables and the right kind of sugars instead of getting too carried away with the refined sugars. And what about exercise? Do you have any suggestions about exercise? How much is okay, and what are the things we need to be careful about?
One thing to be very careful about is if you're someone who's exercising and it's causing you to gain weight, you have to be very careful because your metabolism is not working properly if that's happening. So I suggest with people when they decide what type of exercise works best for them, it's most important to first ask where they are at. If they have a history of exercise, and then they can jump into a more intensive program. If they don't have a long history of exercise, they're better off starting with 3 months of restorative exercise first, and starting off with gentle exercise before they move into high impact exercise. The biggest mistake is to go low calorie and high impact exercise, because your body will be getting the fuel from the muscles if you're not eating enough food. And then that's how you tend to actually gain weight from exercise, because the body will not tap into the fat storage when you're exercising. It gets fuel from the muscles first. So with exercise, again, also to find out, I mean, it's important to understand where your body is in your fitness level. And it's much better to start very slow and not injure yourself than to start just jump into a boot camp and then get injured, and then you can't work out for another 6 months.
Yeah, very, very true. We have to be very careful, and pace ourselves when we exercise. So now let me take some audience questions. We have some questions here from our audience. So one question is about for pain management. You've talked about exercise, but what about massage and myofascial release and your chiropractic background? Is there passive ways of addressing that pain and releasing that pain so that a person is able to feel like they have the energy to exercise?
When you see a chiropractor or see a person that knows how to do myofascial release and massage, those are all wonderful to help a person gap the time from not being able to exercise to getting to a place where they can exercise. But it's very important to see that the modalities and the therapy is a service that fills in that gap. And once the chiropractor helps you, once the massage therapist and the myofascial release therapist helps you, it's important that you help yourself and talk to the doctor about what kind of exercise would be safe for you to start with, and perhaps just use the treatment at that point for maintenance until you can get yourself strong enough to not be able to, to not need regular service other than maintenance, occasional maintenance. And again, I go back to the quality of life, being independent and spending more time doing what we enjoy doing rather than at a doctor's office. There's a time and place for everything, and I think when you're in too much pain to exercise, you need to get professional help. But once you get that professional help, what is the next step? And that's where your chiropractor and massage therapist can help you.
Wonderful. Thank you so much. That was great. The next question that we have is about nutrition and the metabolic aspect. You talked about managing metabolism. So can you suggest what are the specific things when you talk about the fat burning diet or the metabolic diet that we can follow?
Well, if you are a person that are eating properly and you are exercising and you cannot lose weight, at that point you need professional help, because you cannot help yourself. The body has gotten to a point where it doesn't metabolize fat properly, so it's like you reach a stop sign. You can't go forward, because exercising will create more hunger. Hunger will cause you to eat more carbohydrates. Carbohydrates will pack on more stored fat, and it becomes a vicious cycle. If you are not at that point, eating healthy and then starting off with restorative exercise and then moving forward to a more intensive exercise program would be the way to go. But you need to see if your metabolism is working properly for you or not, and you don't know that until you eat properly and start moving. But if you are in pain, then that's not a time to start moving. That's when you need to get help for the pain so that you can move on your own.
Okay, got it. Wonderful. The next question that people have is about detox. You've touched on a little bit, you mentioned about detoxification is needed when you have built up so many toxins or are having metabolic syndrome. So is there a specific type of detoxification that you suggest for people, or do you have like some protocol that you suggest for them?
Well, with detoxification, the thing to remember is the body has gotten into a position where it is storing toxins in the subcutaneous layer of the body, and it's on a momentum. It's in a protective and a guarding type of momentum. So what the person needs to first do is find out what they've been eating that caused the body to do that. Usually they'll find that it's been too much sugar, too much processed foods, too much of the wrong oils and fats, and then a lot of times also too much alcohol. That's common in my practice. I find the body cannot handle the amount of alcohol they're drinking and the amount of sugar and processed oils that they're consuming. And that's very common if you're a person that eats out often, because the processed oils that are damaging and pro-inflammatory, that is the typical oil restaurants use. So the first thing you need to do is stop hurting the body. I would say that. And then the second thing to do is, if you're in pain, get yourself out of pain. If you're not in pain, start with restorative movements and then move up to a more intensive exercise. And it's also great to work with a trainer to avoid injury as you progress in your exercise. And then you put nutritious food in your body. You go to the farmer's market, you buy grass-fed protein, you buy wild fish and wild seafood, and portion your food that you eat enough to feel full, but not enough to be uncomfortably full. And I would suggest that as far as detoxification, if you stop putting foods in your body that hurt your body, the body will start naturally detoxifying. If you're starting to eat a lot of green vegetables, it will help your body to be more alkaline, and your body will naturally start detoxifying. And then water is very important. And most people think if they drink 6 to 8 glasses of water a day, that's sufficient. It's enough to survive, but not enough to thrive. Most of us need closer to 3 to 4 bottles of 32 ounce of water a day. You think about everything in your body is made of water, and you need to drink water in a way that it's not all at once. It doesn't do the body any good to just not drink for 4 hours and then drink 20 ounces of water. You're better off drinking 8 ounces every hour or 12 ounces every hour and a half that you're awake.
Wonderful. Those are some great tips that people can follow. So let me get to our last question. So last question is from a cancer patient, and she wants to know what can she do to manage her fatigue and the cancer-related symptoms that she has during the course of her treatment or a little bit post-treatment.
Well, again, in my office, what I do is a blood test to see what the deficiency in the body, what the deficiency is causing the fatigue. We can second guess what's causing the deficiency, but there is such a wide range, and you can end up taking 20 bottles of nutritional supplements, and you only need 5 of the 20. Now, we can't tell what you need until we test your blood. So you need to work with a practitioner that does laboratory-based testing to see what deficiencies you have, to give you specific supplement to address those deficiencies to help with the fatigue. Another thing is having a rejuvenating, restorative type of movement practice. Like I suggested earlier, restorative yoga, Tai Chi, Qigong, Reiki, get hands-on healing, cranial sacral therapy, get professional help to help move and mobilize the energy in the body. A lot of times we feel so stagnated. And cupping is another one that's good. If you get acupuncture and cupping, that can also help with fatigue. But until we learn what exactly is the cause of the fatigue, you can try 20 different things, and it's just not cost effective. So that's why I feel strong about cost-effective program, and it starts with testing the blood.
Wonderful. Oh, that's so important. I think being able to identify what is the cause of the fatigue, so then you can address it the right way and actually get a solution that works.
Yeah, so lab work is very important.
Lab work is very important for that. Well, that was so wonderful. Thank you so much, Dr. Sherry Fong, for coming and talking to us about your practice and about healthy aging. And I know we touched on a lot of really wonderful topics related to metabolic health and pain management. Thank you so much for your time. Very much appreciated.
Thank you very
And
much for inviting me. I enjoy this very much, and I hope that this can help many.
wonderful. You can find more information about Sherry Fong on our website or by looking up her website. And we look forward to speaking to you next month. Until then, everybody have healthy and a happy month. Take good care of yourself. Give yourself love. Give yourself hope, and have some time having fun and relaxing. And we'll see you soon. Thank you. Bye.